Now, in May 29th of 2019, the county government of Kirinyaga dismissed a total of 644 permanent and pensionable health workers after the workers went on strike due to claims of deplorable working conditions, among other welfare issues. The dismissal that was done saw workers who were not part of the strike, such as those on maternity and sick leave, also suffer the same fate as their colleagues on strike. Close to 3 years later, our health and science reporter Zainab Mohammed met up with some of the dismissed and forgotten health workers of Kirinyaga County and brings you this special report.
In Gashongo area, Kirinyaga County, meet Winfred Wambui Njagi, mother to Joanne Wanjiku Wambui, a former employee of Kirinyaga County government. The late Joanne worked as a nurse at Kiangombe Health Center before being dismissed during the mass dismissal of 2019. According to Joanne's mother, she did not participate in the strike as she was in her maternity leave.
Alisimamishwa mwaka wa 2019 na wakati alisimamishwa Joanne hakushiriki kwa mgomo juu alikuwa maternity leave. Alikuwa maternity leave from alipewa March to August, lakini walisimamishwa June. Sasa wakati alirudi kazini akapata wamesimamishwa, na ikasemekana hata amesimamishwa juu alisimamishwa na sisi wote wale walikuwa.
Upon the completion of her maternity, Joanne went back to work only to be turned away as the rest of her colleagues.
Tukakaa ile pesa kidogo nilikuwa nayo ndio tulikuwa tunatumia. Kura mtoto ndio tunamlisha na yeye mahitaji yote ya mtoto na yetu tulikuwa tunashughulika na hiyo pesa yangu kidogo mpaka ikaisha. Wakati iliisha tukaona sasa hatuwezi kaa huko tena, tunaweza kufa na njaa, tukarudi nyumbani. Sasa akajaribu kufuatilia akisema hakuwa kwa mgomo, alikuwa maternity leave, lakini hakuna mtu alimsikia. Kwa hivyo ikakaa hivyo.
The now ailing and nursing mother of one struggled to make ends meet whilst maneuvering a hefty medical bill.
Mwaka wa 2020, hiyo mguu yake ikawa na uchungu sana juu alikuwa na mguu imefura sana na alikuwa ameadvisiwa aende India. Sasa ikawa ni wakati wa kutafuta pesa. Sasa wakati huo sisi wenyewe hatuna pesa. Majirani tumewasumbua, hakuna kitu. Tumeishiwa kabisa. Tukapanga kufanya harambee. Tukifanya harambee pesa haikutosha. Pesa ilipokosa kutosha, sasa hakuna kwenda India, bado ugonjwa inazidi.
Joanne lost the battle to illness in 2021. At the Father's Catholic Dispensary is yet another nursing mother dismissed during her maternity leave. Cecil Njiru, a lab technologist and a former worker of Kirinyaga County government, remembers the fateful day as if it was yesterday.
Actually, I was dismissed when I was nursing a premature baby. I gave birth to my baby when she was 31 weeks, and I went on maternity leave, and when the maternity leave was over, I took an annual leave so that I could stay at home with the baby for quite a while before I could go back to work. So when I was on annual leave, that when the strike happened, and later we were dismissed.
Life has not been very kind to her since then. The mother of 3 has been forced to make many changes to her life in order to survive the harsh realities of joblessness.
I went to take drastic measures because I could not manage. So in 2020 January, that's when I went to change my children to different schools. One went to a public school, the firstborn, and the other one went to basically low school here in Kirinyaga, and that was not what I really wanted. I also went to stay at home now in the year 2019 because I could not afford to hire house help.
In Kerugoya town, Clinical Officer Anthony Kariuki is yet another dismissed former employee of Kirinyaga County government. Anthony took part in the strike.
So many letters to them, trying to persuade them to address the issues that we are facing. But unfortunately, no one dealt with the issues at hand by then, and that is when we gave a strike notice. Then we proceeded to the strike.
Unfortunately for him, both him and his wife worked for the county government of Kirinyaga, hence both were dismissed during the mass dismissal.
My wife, coincidentally, was working in the same county, so both of us were rendered jobless at the same time. And having a family in town, yet you don't have something to bring income, life is so hard, so hard.
According to Anthony, the highly contested strike was unavoidable due to the deplorable working conditions. The health workers claim that at least 8 of their colleagues contracted hepatitis B at one of the county hospitals back then, while a snake was found in another hospital.
Even the theaters were leaking when the doctors were doing operations, which is not right, because the moment that you open up a patient's abdomen and then there is more fluid that is being added from the loop to the patient, is that really justice to the patients?
There were even bushes and snakes. I think around 8 of our colleagues, and by colleagues I mean in the health fraternity, they actually contracted hepatitis B.
Some got skin infection and chest infections because of the dirt that was accumulating in the hospital after the support staff were dismissed, which was also illegal.
It came to a point that we saw that our members will die in those working places, because we have members who contracted diseases just because the hospitals were dirty. Could you have waited longer, even if it was somebody else? I don't think so.
The tales of dismissed, struggling and forgotten health workers does not end. Gishugu Kimaita Philip, also a lab technologist, was not spared in the mass dismissal. The blows of joblessness hitting him much harder than his colleagues, lack of an income alongside an unserviced loan, drove him into depression.
I earned some people that who had guaranteed me money through a circle. These people started calling me. They are the people, some of them are working. They started threatening me. I was in a point almost selling my property that I had bought a long time ago for me to pay them. And these people were calling me to tell me it's better I sell my property and I pay them. Amount which was almost 1 million. So at one point I told them maybe wakuja waniuze mimi mwenyewe.
He now runs his own small lab in Kerugoya town, but still struggles to make ends meet. During the mass dismissal of 2019, a total of 644 health workers from the various cadres were dismissed. About 200 were reinstated back to work with no pay to date, and a little over 400 are still fully locked out. Unionists say such stalemates are not only being witnessed in Kirinyaga County, but many other counties in the country, with the governors being accused of creating hostile working conditions.
And that is what we are lacking, not only in Kirinyaga. Also in Laikipia, you remember there are doctors who are dismissed. In Mombasa, I think they have gone on strike because of lack of salary until they are not doing it anymore. They have gotten almost gotten used to it. So it's a problem that cuts across. And I think it's time that we ask ourselves, did we really make a mistake devolving healthcare?
In Laikipia, we also have 34 doctors who are dismissed by the county government on 20th of 2019. These doctors were reinstated by the Public Service Commission. They were again reinstated by the courts, by Ombudsman, also talks of the Justice Administration. But 3 years down the line, the people of Laikipia, the people of Kirinyaga cannot get health services. Laikipia people do not have specialists because all the doctors who are dismissed were specialists.
Further, unionists claim that it may have just been too soon to have devolved healthcare services.
Since the devolution of health, we've had more than 100 strikes. If we advent strike of the national strikes. And this is because the county governments look at health care as an expenditure. So all the counties are seeing that they have reached the selling point of their budgets, the minimum budget they need to have. So as in the counties as of now, the doctors and all other healthcare are there, are not being promoted. Their salaries are receiving salaries so haphazardly. You realize that some counties goes up to 2 months, 3 months before paying salaries. So for those who consistently depend on the salaries as the source of their livelihood, they have to down tools so that they can be paid. And this has been happening in so many counties.
The country must look at our recourse on how we need to overcome this situation. Otherwise, it might not be well. Some people will be saying that we have done a lot of development in the country. Probably development in terms of those people who are in the leadership, especially the political class. They think development is just building structures. It is brick and mortars. And this does not add value. And I want to assure you that any trained healthcare worker can see a patient under the tree and deliver service, provided I'm fully supported. We do not need those buildings.
Despite the strike being declared illegal by court back in 2019, the workers have since managed to get a ruling from Nyeri Law Courts and the Public Service Board directing the county government of Kirinyaga to reinstate them back to work. This, however, has fallen on deaf ears.
We appealed at the Public Service Commission because any decision made by the County Public Service Board can be appealed at the Public Service the Public Service Commission. That is to mean every County Public Service Board exercise a delegated authority from the Public Service Commission. So the Public Service Commission can relook into any decision of the County Public Service Board. So if they find that indeed the procedure was never followed, so they can overturn that decision. So that's what happened. They overturned all this decision and actually ordered the county to allow these people back to work and pay them their dues. That is around last year, September.
The Public Service Commission was able to give us a very positive direction and directed the Kirinyaga County government to reinstate our people. The problem is that the county has refused to do so. What the law says is when the county refuses to do so, then you go to court. So we have gone to court to seek for the orders for the reinforcement orders. Those are the orders to reinforce the orders of the Public Service Commission, and we are still waiting for that.
The county government of Kirinyaga acknowledges receipt of the two rulings. However, the existence of other employed health workers on contract complicates the matter further.
The county government is very much aware. The county secretary was aware. And the governor once more said no. And she filed an appeal against those orders. And you know, when an appeal is filed, it has to be listened to. All she has been doing is to frustrate these people. Yeah? Well, I can only summarize that the orders have been given out. These guys should be reinstated. But on the same hand, she has employed other people on contract. So she's also between a catch-22. Where do I take the ones that have put on contract as I obey this order?
The county boss, Anne Waiguru, has since filed an appeal to block the rulings further.
The courts have talked. The HR team has talked. The Public Service Commission has talked. So what more mediation is required? This is what we call the abuse of the court process. And, you know, not considering that somebody somewhere is suffering. The many years that these guys have been out of office, no one, I mean, the CEO of the county doesn't seem to understand what they are going through. She has no mercy for them. She only thinks about herself and her children. This is very wrong.
Efforts to get a comment from her on the matter were futile. The workers, even though defeated and struggling, remain hopeful that justice might one day be theirs and that they might just get their rightful jobs back. Zainab Mohammed, T47.
Thank you, Zainab, for that.